one.
Knock, knock. Hi, I'm Arlo. I'm going to be your student nurse for today. Could you verify your name and date of birth for me? I verified it, and it matches everything in our records. Okay, today I'm going to be performing a wound dressing according to the doctor's and physician's orders. Are you in any pain? They say no. If they were in pain, I would administer medications 30 minutes prior to performing this procedure. So I would do hand hygiene, and I'm going to put on some clean gloves. And make sure beforehand that I have all of the supplies needed for the physician's order readily available. So I would open up this kit, and I would just use 1 inch off of it and close it back up to maintain sterility. And I would open up this bag so that it makes it easier to dispose of everything from the dressing change. Okay, so I would start removing the tape. I would look at the AVB pad and look at if there's any drainage, the coloring, any odor coming from it. I do notice that there is serous sanguinis fluid coming from it. And as I'm taking the dressing out, I would acknowledge and count how many and see if that matches our previous documentation. So there are 2 dressings on top, and then I would just assess the outside to see if there's any like redness, anything like that. So okay, I'm going to take this out, make sure not to hurt the patient so much. Again, acknowledge any dressing change, and there were 2 dressings on top and 2 inside the wound as well. So I would acknowledge the texture, again, like I said, color, odor, and the amount of drainage that there is. Okay, and then I would take off my gloves. I would perform hand hygiene. Stop. Correction, before I would have started the dressing change, I would have put a tarp down to cover up anything so there's no dressing or wound drainage on the bed, and cover up the patient from the wound, that area that I'm not currently using. After that, I would perform hand hygiene and put on another pair of clean gloves. Okay, and then I'm going to start measuring the wound. So I'm going to get a Q-tip. And use the measuring guide. Okay, so I see some tunneling around 2 o'clock, and I also see another tunneling around at 9 o'clock. There's undermining all the way around the wound. Make sure as you are measuring that you are not touching the patient's skin to cause any irritation or break any sterility or cause any added bacteria. Just measuring that above the patient. And the wound is, it's 6 centimeters in length. Now we're measuring width. Make sure to try not to touch the patient again, like I said. And I would say in width it is 5.5. So I'm going to change. Actually, I'm going to use the same one since I did not touch the patient with it. I'm going to measure the depth at the deepest part, and acknowledge that this can be really sensitive to them, so you don't want to put much pressure or anything down. And I would say this is 1 inch in depth, and I would get rid of that. And then I would take another Q-tip and measure the tunneling. I'm going to start with the one at 2 o'clock. Okay, that is 4 centimeters, and then I'm going to get rid of that and open up another package and measure the one at 9 o'clock. This one is only 1 centimeter. Okay, and then I would take off my gloves and dispose of them. And after this, I will document my findings, like I said, the length, the width, the depth, tunneling, undermining, and talk about if the texture, odor, and amount, and the color of the drainage. So now I will open this up. Just use 1 inch again to grab this sterile field. I will move this over and use 1 inch to open it up. Move things out of my way. And leave it open like that. So now I will get this and then try to jump it out and make sure not to touch the inside because the inside is sterile, and jump it out as gently as possible. Okay, and then I'm going to leave this over here. So now everything in this area is sterile. I'm going to organize my area as best as possible to not break the sterility and give me enough space to work. So now I am going to put on sterile gloves. I'm going to open this away from me. Use 1 inch of the end, like stated before, away. And before I would touch this, as a correction, I would perform hand hygiene just to make sure that everything is clean. I would open this up, keep this open. And then I can touch this inside that is sterile part and make sure to touch only sterile to sterile and non-sterile to non-sterile. Okay, and then I would grab this one and make sure to touch only the sterile side. Okay, and then I would make sure to put my hands above here and not to put my back towards this because that would break sterility. Okay, I'm just gonna, the inside is sterile, I'm going to dispose of it. Okay, now I am going to ask for an assistant to help pour this normal saline into the bucket with the gauze.
I performed hand hygiene and I have clean gloves on.
I would need you to open the package of the gauze. And then because the outside of the gauze is unsterile, but I am able to touch the inside and put them inside.
How many?
Just 3, I think. And then as I'm putting it in here, I'm going to count to make sure that follows with whatever I put inside. Okay, and put these 3, and thank my assistant for helping. Okay, and then I'm just going to just organize my area so that everything is neat. And these are the 2 gauze that I will use to put on top. Okay, so initially I'm going to use the swab sticks to clean the wound. I don't want to make sure that there's any drippage because that could cause moisture and cause further infection. So I'm just gonna go around like this and clean that. And then go on the opposite side and go around like that and clear the undermining underneath the skin and dispose of that. And I'm going to get another Q-tip and go in the tunneling. And make sure not to put too much pressure, but you want to add that extra moisture. And then I'm going to clean the inside using one side, and then the other side I'm going to gently clean the other tunnel. Okay, and now that the wound is clean, I'm going to get the gauze from in here, and I'm going to bring them out to make sure that there's no drippage or anything like that, because I don't want that added moisture. And I'm putting my fingers down so that the water runs off so that it doesn't stay on my gloves and drip everywhere else on the patient. So once I think that there is an adequate, there's no drippage, then I get the wound, the gauze, and I try to fluff it up a little bit. And then I wrap it around my finger, and I use these forceps to help me pack the wound. So you want to try not to touch the outside of the skin because that is not sterile. So I'm going to try to pack this tunneling at 9 o'clock. And you don't want to put too much pressure in there and not leave enough space because that could affect the wound healing. Pack it in there, and I want to make sure to try to pack the tunneling as much as I can without causing added pressure. Okay, then I'm going to get another one, drip it like before, and then wrap it around my finger like previously. So I'm going to put this in the rest of the area and try to leave adequate room for healing and granulous tissue. I'm going to take the last gauze, buff it out, and pack the wound. Okay, once that is done, I'm going to take these dry gauze 2x2s and put them over the wound. And as I'm doing this, if I notice any sign of infection or any additional changes that weren't noted before, I would make a documentation of that. Okay, and then I would take the EVB pad and I would make sure, okay, and then I'm gonna put the EVB pad on and make sure the blue side is facing up. Okay, I'm going to take off my sterile gloves, dispose of them, and perform hand hygiene again. And I would get this tape and I would wrap it around the wound in a window pane style. And I do not want to put any tape on top because that could cause extra moisture and heat, which could breed an infection. Just measuring out beforehand. find the wound dressing. And then I would take a pen and I would initial and write the day and the time. And then I would clean up all of my area. And dispose of all of the extra materials. I would ask the patient if they're any pain, if that changed or anything, and then I would give them the call light and tell them if they need anything that I can be there.